There's a lot of medical news making headlines today. So we, of course, have our Dr. Payal Kohli here.
Hey,
welcome.
guys.
You look very springy.
Well, thank you. I thought I'd bring the color since we're getting snow.
Dr. Kohli, did you hear Dr. Jackson's running for president?
Oh.
I was gonna hold
How
off
many
till the end of the
careers
subject,
can one man have?
a lot when you're out.
He's a very, very inspiring guy. Very inspiring.
There's a lot of talk, no follow-up.
Well, Doc, let's get serious for a minute. So, yes, Dr. Kohli. Ray Romano underwent surgery after doctors found a 90% blockage in a major artery. So how do we know when you have that blockage inside? How would I know?
A 90% blockage, Jeff, will declare itself. So you'll have some symptoms when you're trying to do anything. Shortness of breath, chest pain, chest pressure. It could even be some mild symptoms like, hey, I've started to slow down a little bit, or those stairs are a little harder than they were before. So that's the good thing about the severe blockages. But here's my thing. We need to find the blockages before they become severe. So we need to be finding them in the mild to moderate range when they're not having symptoms, which means that we need to actually go looking for these blockages. So I think we're failing people because we're being reactive. We're waiting for the blockage to declare itself. Then we do some plumbing, we put in a stent, we open it up. We need to find those blockages early so that we can change the trajectory and they never become severe.
Wow. And well, that's done how? Like through a physical, or how does that work?
So now in 2023, we have technology, a simple X-ray called a calcium score, which everyone over the age of 40 should get. So talk to your doctor, just gets an X-ray of your heart, tells you if you already have any calcium deposits in the blood vessels. If your calcium score is anything but 0, you have heart disease.
Wow.
Do they put like dye in there or something?
No dye.
Just straight X-ray?
It's like a CT scan of your heart, and it'll tell you if you have any. Now, if your calcium score comes out at 0, don't be faked out, because it usually takes plaque about 5 or 10 years to develop calcium on top of it. So you could still have early plaque. But if it comes out anything but 0, and I have a friend, she's 43, strong family history. I made her go get a calcium score, and it came out at 3. Doesn't sound like a high number. But at 43, it should be 0.
Wow, that's so important. I'm so glad you're saying this. And speaking of Ray Romano, he did mention that he regrets not taking medicine earlier, not eating healthier to lower his cholesterol. How does medicine versus like a diet, does a diet actually help reverse heart disease?
You know, I hear this question all the time, and people say, I don't want to take a statin, I'm going to work on my diet. So if you talk about where our cholesterol comes from, only 25% comes from what we eat, 75% comes from what our liver makes.
Wow.
Now the two talk to each other, so if we're eating really bad food, or really good food that's bad for us, then it revs up the liver to make more cholesterol. But even the best laid diet is going to drop your cholesterol about 20%. Now compare that to medications like statins that can drop you 50, 60%. And so if you need a big delta, you need to drop that cholesterol aggressively. You are just fooling yourself, and you're in denial if you think you're just going to diet and exercise your way out of it. You often need a combination of both.
And Doc, when I was in your office really quickly, this is important. I know we got to go. You said black men start out kind of unfortunately ahead of the curve in terms of cholesterol. Like it really shocked me into taking my statin. So. Thank you.
And genetics, Al. You know, whether it's high blood pressure, whether it's cholesterol, whether it's heart disease, we know that Black Americans do worse. They start earlier in their life, and even after they get diagnosed, they don't get the same level of treatment. So we just have to do better, I think, for all Americans.
Absolutely.
Wow, this is coming from a cardiologist, one of the best in
Maybe
the world.
vice president?
Yeah.
Oh, I like
President.
it.
Oh, okay.
Even better.
Which one does no work?
Dr. Kohli, thank you so much for being here and answering all of our questions. DBL Nation, did you know Dr. Kohli has a podcast? Check out Heart of Medicine wherever you get your podcasts. We'll be right back.
Thanks, Doc.